One sec. Hi, good evening, friends. I think the camera looks better this way. Hi, good evening. I'm Dr. Mahesh Nair, once again back with a YouTube live session this time. Usually it is an Insta live, but this time I thought of going in for YouTube live. And the topic for today is a much sought after topic, which I've been pushed, uh, saying that, please speak something on this topic, something new that you have. And yes, we have something new. We have new machines, we have new techniques. So definitely there's something worthy to talk about on this particular topic of gynecomastia, or man boobs, or male boobs, or male chest contouring, whatever you can call it. And it's one of the most commonly done surgeries in our center over here. So let me have a brief introduction of myself. I'm Dr. Mahesh Nair, a cosmetic plastic surgeon, as you all know. And I have my center here in Panampally Nagar, Cochin, where we do extensive, exclusive cosmetic plastic surgery. There's no other surgery being done over here, so it's mainly cosmetic plastic work that we all do. And okay, getting that off the picture. So speaking more on this topic of gynecomastia now, as we all know, it's quite a common condition. It's not that rare also. About 40 to 70% of the men have gynecomastia, frankly, and it's a condition. It's not a disease. So first, get that out of your head that it's a disease and I'm suffering from gynecomastia or something. No, you're not suffering from gynecomastia. It's just a condition. So what that means is basically, uh, one common question that I get asked at this point of time is, why do I have gynecomastia? Like, is it genetic? Is it hereditary or something? Well, gynecomastia is a condition where genetics do play a role. So, it's basically a maldevelopment, I can say, of the male breast gland during your adolescence, when your estrogen is comparatively more than the testosterone, because testosterone kicks in at adolescence, and starts building up from there. It's not like it's there in the male child right at the beginning itself, to that an extent that it can bring out all the male secondary sexual characteristics. So we all know that at puberty and adolescence, our secondary sexual characteristics start developing. The male voice deepens, you get facial hair, you get growth of your muscles and things like that. And it is around at that point of time when you start noticing the effects of testosterone in a man. Some get it a little earlier, say 18, 19 or so, the full effects. Some get it a little late, say 23, 24, and so this interim phase, which starts from puberty at around 12, 13 to adolescence and young adulthood till about say 20, 19, 20 roughly. So this is a little turbulent phase in every individual's life, be it a man or a woman. In women, the hormones start raging. You've got estrogen, you've got progesterone, a plethora of hormones. Whereas in men, basically in boys, when you start off as a boy, you have estrogen coming from your the steroid hormone production, your adrenals. So all these glands in your body also generate estrogen and the female sex hormone. So along with that, when testosterone comes into the picture, it starts dominating, it starts taking over. But until that time, if your breast gland has been stimulated by estrogen, okay, that is what is gynecomastia all about. And this gland has a tendency to draw in fat and sit over there with you. So that's why the gland is per se never just a glandular tissue, but it has a fat component to it as well. So that's why when we do a liposuction, that's why we do a liposuction along with gland excision, in basically a combination of two surgeries in one, to give you the best possible result. So the evolution of this surgery has been such that earlier they used to take a big cut, a big nick, and then go in to the chest and take out all the gland, just like how a female breast used to be operated, or is still operated in the mastectomy. Okay, but of course nipple sparing mastectomy, that is. So you don't remove off the nipple, you keep it over there, maintain the sensations as far as possible. And from there the techniques have evolved so much so that now it is just merely a keyhole surgery. What that means is basically you make four keyholes that we usually do. So two in the armpits and two at the nipple areolar junction. So if you check my YouTube channel, YouTube channel, or even the Instagram page, you'll find that there are a lot of gynecomastia results wherein I've shown and asked, whether you can really identify the scar or the mark from where they've entered the port sites and all. So I hope I'm audible with this microphone. I guess so. It is audible, but yeah. So that's yeah. That's how we go in for this surgery these days. I'll come to the technicality a little later as to what exactly we do and how we go about. So that is the history of what a gynecomastia patient typically gives. During adolescence, I started developing this gland, and it remained with me as I grew. So there is something called pubertal gynecomastia. That is this. In some individuals, it reverses itself back, whereas in some it doesn't. So in those in whom it doesn't, that is where we go in for the surgery if they desire a surgery. So okay, so gynecomastia can also come because of other conditions. I mean, there are hormonal conditions where there are pituitary adenomas or something like that, which secrete hormones which stimulate the production of the gland. Some particular drugs used to stimulate the production of estrogenic compounds, and that leads to gynecomastia. So all these factors have to be first considered, whether whether a client has these in the background or not, and then only can we confirm, say, whether your gynecomastia is genetic, hereditary, or what is it because of. If it is because of one of these agents, stop the agent. Your gynecomastia has a bright chance of reversing itself. If it doesn't, I mean, if these agents are not there in the picture, then definitely it is because of your adolescent gynecomastia, what has set in at that age, and now it is just simply growing. Because if you have got a weight gaining tendency, then so will the gland gather in more fat and sit over there. So that's what we discuss in the history when we ask you, why do you have this gynecomastia in you, and what can we do about it? So then I get asked, like, is there any medicine to rectify it? Well, to be very honest, there's no medicine to rectify gynecomastia. You cannot go back, okay, from that gland which has got stimulated. It grows to a finite size and then it cannot go back. So many I see on my Insta wall, many people comment, especially gym trainers, that you work out a lot and the gynecomastia is going to go. I would not agree with that, because pseudo gynecomastia, what is false gynecomastia, may go. Okay, that is because it is a fat deposit, and that generally can be reduced if you have significant weight loss or fat loss. Then it can go. But what will you do with the loose skin? I ask over there. Number one. Secondly, if it is true gynecomastia, wherein you have a gland does not go away with any amount of exercise that you do. So the gland is here to stay, and for that you can't have any medicine possibly to liquefy a gland. You even a vaser or in the ultrasonic liposuction or any technology basically cannot liquefy a gland. So we have to go in with the old-fashioned way, with a small scissor through the keyhole, and take it out piecemeal. So that is how a gland is taken out. So if a gland has to be addressed, which is the what I can say, the bedrock of a gynecomastia, which I have to fix, in that case, definitely you need a surgery. You cannot go ahead with any medications and hope that the gynecomastia is going to reverse. No Ayurvedic or homeopathic medicine is going to work over there, guys. So you will need a surgery. That's one clear-cut indication. That's why we do so many gynecomastia surgeries, not without any reason. So then the second question comes, what kind of physical fitness do I need? See, the gynecomastia is divided into grades, as we all know, grade 1, 2, 3, 4. So the 1 is the least grade with the smallest possible gland. 2 is slightly larger with some amount of fat around it. 3 is even larger than that with more fat around it. The whole disc becomes more than 4 centimeters in diameter. And grade 4 is when the gland starts hanging and it becomes ptotic, like a breast. It develops an inframammary fold or a fold beneath the breast, and that's how it hangs. So grade 1 and 2 are considered smaller grades of gynecomastia, and 3 and 4 are considered to be larger grades of gynecomastia. So when you consider grade 1 and 2, they can be to a certain extent be done under local anesthesia. But that also depends upon your pain tolerance, your pain threshold, how well are you going to cooperate with the surgeon to do the surgery. If there is going to be trouble, sustaining those little pin pricks or something like that, and that is going to pain you a little bit, then I would rather suggest going for a short general anesthesia, because at my center it works best that way. So we use sevoflurane as a gas, which is a very expensive and advanced anesthetic gas agent, which effectively gets drained out of your system by exhaling at the end of the surgery when you start breathing naturally. So the thing is, you get to go home the very same day. That's what I'm coming to. It's a daycare surgery, so it's morning admission, evening discharge. Even if it is grade 1, 2, 3, 4, whichever grade it is, you go home the very same day. You don't have to stay overnight over here, and there are no drains or anything of that sort that are used because the way I do it, definitely I don't need any drains for draining any fluid which may be collecting over there immediately or so. Coming to the seroma and complications, I'll touch that a little later, why we don't use drains and what anyway would they do. So we need a finite amount of blood tests before the surgery begins. So we get the basic investigations done, and that's what helps our anesthetists give fitness to your case, and that's how we begin. So once the surgery is scheduled, it's very straightforward. You come in the morning of the surgery, follow the instructions that we have already given you a night or day, 2 or 3 days before, and that's all what you need to do. Your surgery begins in the morning. By afternoon, you're free. By evening, you're back home. It's as simple as that. The dressings are also very minimal on the chest, which lasts for about 4 to 5 days, after which we open, and all the stitches are dissolvable, so you don't have to worry about the stitch removal later or anything of that sort. Because I get frequently asked that, after how many times do you have to visit after the surgery? And after the surgery, trust me, you need to come mainly just once or maximum twice. That is once at 5 days when I open the dressings, and at 1 month or so when I need to see you finally how it has settled. Well, if you have the tendency of developing a seroma, or by any chance, seroma is basically collection of serous fluid. Now, why does that accumulate? Now, suppose you have grade 3 and grade 4 gynecomastia, which is a larger grade. You have got a huge gland sitting there and occupying space. When I remove that gland and fat from there, you have a dead space. That is an empty space, okay? And the body has a tendency to secrete fluid into this space. So that is how a seroma, which gets eventually a little blood tinged, and you may get a little bloody looking fluid over there, not frank blood, definitely. There's no vessel that is leaking over there. So this kind of a collection, a serosanguinous collection, basically needs to be tapped. And for that, you may have to come once or twice, or maybe sometimes 3 times also. Depends how huge your gynecomastia has been, and how much of surgery has been done to get rid of it. So you just put in a tiny needle and take it out. But that instruction I give only to my grade 3 and grade 4 clients, because seromas are very, very rarely, in fact, I've never seen one happening in grade 2 or grade 2B, even early grade 3 sometimes. But grade 4 and all, I definitely warn and keep that, you might get a seroma, so be mentally prepared for it. So after the investigations, the surgery is conducted by, the surgery usually gets over in about 2 hours maximum, not more than that. Even if it is grade 4, maximum 2.5 to 3 hours, not more than that. So we remove the gland in toto. That means the entire gland is taken out. And okay, some question came over the surgery rate. I'll come to that a little later. One second, I'll answer that as well. So the whole gland is taken out. Now I get asked over here, is this a permanent surgery? Is my result permanent? Well, yes, it is permanent, provided your gland has been taken out entirely. And when we do the surgery, we ensure that all the gland is taken out over there, all the glandular tissue is taken out, and along with that, the surrounding fat is also taken out. Another question keeps cropping over here: can I only get the gland removed and not liposuction? So recently, I did a case for a bodybuilder kind of a person, and in him, it was so the gland was so well delineated that it was only the gland and there was no fat around it. So in that kind of a case, definitely I will not do any liposuction. But that is one-off. That's a very rare case. It's like a state level or national level bodybuilder. So that is also a very rare finding. So if at all, if there is slight amount of fat, also don't be scared. We need to do the liposuction over there to, feather out the tissues. Basically, it gives a nice finesse to the surgery. Sometimes I even add fat grafting to the case, so that you get that what men generally like is a gladiator chest kind of a look. So even that can be generated, wherein this particular region is loaded with a little bit amount of fat in the muscle and just above it, so that it looks more fuller. You don't have to hit the gym to make a pec. I make the pec for you over here. So that also can be done, added to the gynecomastia. That is not something very new, being done abroad in many centers, but that depends on the patient's requirement. What kind of a chest does the patient desire? What kind of a tummy does he have? What kind of arms does he have? So if you're well chiseled, and your tummy is also fine, and yet you have the gland, then yes, definitely, gland removal with a little bit of feathering liposuction will look good. But if you have like a pot belly or something like a big belly with flabby arms, and then you have got a fat grafted gladiator like chest, that will look really awkward on your frame. So what suits with the rest of the body is generally done or offered. It's my duty to explain everything to you, and then it's I can let you decide what you exactly want for yourself. So you can either offer fat grafting or not. And of course, we use a lot of different technologies for conducting this surgery. So what we have at our center with us is a power assisted liposuction, which is the basis for all liposuctions. We don't use the simple suction assisted lipectomy anymore. So power assisted is the base level of liposuction that we have. Apart from that, After this, we have the ultrasonic liposuction, brand name Vaser, Liposaver. There are a lot of brands available in the market. So it is one of the best in the market. So definitely an ultrasonic liposuction liquefies or emulsifies fat in a better way, more uniform way, less pain, less downtime, practically no bruising. Trust me, I've never heard any of my gynecomastia patients say later, doctor, I've got severe pain, or I've got pain, I'm incapacitated, I can't work, I can't do this, I can't do that. Bruising, yes, in some cases it is there. I'm not denying that entirely, but it's much lesser than what a conventional liposuction would do for you. So there is ultrasonic liposuction, and of course, the new addition to the armamentarium is the body tight. So that is an Embrace RF machine. That is, RF stands for radio frequency. With that, what we do is we give radio frequency heating to the underlying tissues. So what that does is that liquefies fat, that tightens the fibroseptal network of the skin, and the skin and the tissues start adhering to themselves right on table. So we get something like 30 to 40% of a skin quality improvement in the chest using the body tight. We may or may not combine it with Vaser. That decision is best taken on table after we see and feel your tissues from within. So even if we do a Vaser, it's fine. Even if we don't do it, it's fine, because body tight is there to take care of it. It's like the next level of liposuction, liposculpture, not suction, because suction is still done by the power assisted liposuction. So we have to anyway combine most of our machines and then deliver the result what is best suited for you. So I would say that body tight we generally reserve for grade 4 cases, sometimes in grade 3 as well. So grade 3, grade 4 is generally for body tight because you have got a lot of loose skin and that loose skin has to be tightened. Trust me, even if body tight is not done and you have just done Vaser liposuction or ultrasonic liposuction, we have observed that the skin never sags. You don't have a sagging loose skin or something like that. It always is firm and held back. The only thing you may get are some pleats and the areola shrinking in down. Another question that I get asked here, doctor, why didn't you trim or cut the areola at that stage itself? Now you have to understand that you've got a little excess tissue, and if you've seen all my pre and post ops, what I show generally all my patients immediately after the surgery, the areola that they came with was a little broad and flattened out with no wrinkles. When they go the same evening, the areola is shrunken in size and it is wrinkled. Okay, so this change is almost immediate because the gland has been severed from underneath it totally. The gland is out and nipple areola is floating now. So the thing is, it shrinks and shrivels. So it continues to shrink on itself as it heals. Anything that heals us, when it scars or when it heals by fibrosis or something, it shrinks in size. So the thing is, the areola is eventually going to shrink. So if I cut and trim it more, it might cause some abnormal pull later and it may get distorted. So that is why we leave the excess tissue there at that point of time, maybe just a little excess. Some I may excise it. Okay. And that we observe after 3 months, 6 months or so. If at all it doesn't go back, then we can always go under local anesthesia and trim it off. So it is for your benefit that we leave some amount of extra tissue there of the areola, rather than cutting it to such an extent that later it contracts and it gets distorted. That will look even worse than the gynecomastia that you came around with. Because trust me, people have the habit of seeing a gynecomastia affected chest, but they don't have the habit of seeing a very distorted, grossly distorted nipple. So that has to be factored in and taken into consideration when we are doing the closure. So closure we normally do with absorbable stitches, so you don't have to come back for stitch removal, because most of my clients are either flying in from somewhere and then they ask like, when can I fly back, and will I have to come for stitch removal or something like that? Definitely not. If that's not needed. So it's a very tiny incision, roughly 5 to 6 millimeters in the periareolar region and about 3 millimeters in the armpit. Armpit one is concealed because nobody can see it when your arms are down. When they're up also, it's inside the hair bearing area, so practically you can't see it to that good an extent. And the lower one, the periareolar one, is just 1/4 of the entire circle, or maybe even smaller, because what happens is when the areola is this large, we have made the cut. After removing the gland, it becomes this small and the cut becomes smaller in size. So you don't have to worry that it's going to look bad or something like that. Anyway, the chest have hair, they are going to grow. They're going to grow definitely over there, and that is also going to cover it up. So plus the scar eventually, it keeps fading off. But trust me, no scar from the human body ever disappears. Don't be under that impression that, doctor, my scars are going to disappear. Are they going to disappear in the first place? And what will happen? The second fear is of keloids, because some men have this chest keloidal issues. Will that scar keloid? Well, it can keloid. I can't say for sure that it will not. It can even hypertrophically scar, which means it can form a thick scar, which is not a keloid. So don't get confused between those two conditions. There are always remedies for this. It's not that it is untreatable or something like that. Of course, when we close it without any tension. So so that the keloidal tendency is absolutely low. So you don't have to worry on that front that, it will keloid for sure. For all you know, till date, frankly, I've never seen keloid coming in that scar region over there, because it somehow heals well. It's all contractile tissue. It's the areola basically. So it settles brilliantly well, trust me. And I generally don't like creating a very flat artificial chest because it looks artificial, as I just said. So you leave some amount of fat over there, maybe half a 0.5 just about 5 thickness layer of fat in the upper chest and all over there, rather than debulking it entirely of the fat, so that you get a nice natural contour to the chest and not an artificially flat chest that looks really hideous. So we don't like to do that. And we also sculpt at the same time the sides, the armpits, basically the groove between the pectoralis major and the latissimus dorsi, the two muscles. The groove has to be appreciated. Your serratus bellies, your extensions, your digitations of the serratus may be visible from there. That would be a very good thing, because you get almost a chiseled chest without doing much for it in one day, in just a matter of 2 hours. So even that can be done. Fat grafting can be done, as I told you earlier. And any areolar correction, asymmetry correction, maybe shifting them a little bit or changing their shape, like some like on oblong oval, which is horizontally oriented, even that all can be done. There's no issue of that. And at the same time, we give dressings, we give a pressure garment along with the surgery itself at the same time. So you're expected to wear it 24/7 for at least 4 to 6 weeks, depending upon the grade of gynecomastia that you present with. So pressure garment really works wonders. I'll tell you how it works wonders. It gives a finite amount of pressure to the chest, not too much, not too less, but to dissipate the edema, the swelling, the induration, the hardness of tissues, basically. That all is brought down by the garment. If I do 60% of the job, 40% is done by the garment, so it is not a waste. And we generally provide very high quality garments which will last you through the entire what I can say 6 to 8 weeks very easily. It does not lose elasticity, or it does not become bad. You can of course hand wash it, dry it, and wear it back. In this present weather, definitely it will dry in a jiffy. So that also is not an issue. The garment, what it does is it even reduces pain, because it's like a plaster, so it doesn't let you move too much. You can move, I'm not saying you're like plastered to the garment or something like that, you can move, but then it is like kind of, it holds you back together, it holds you down together. All the swelling basically comes down faster. So that's why a garment is very, very necessary. And luckily, all of my patients very religiously wear them. In fact, they may wear them even longer than necessary. That's fine. It doesn't cause any harm if you wear it longer, even beyond the regular 6 to 8 weeks. So that is there. And apart from that, there are very few restrictions in gynecomastia surgery. Like the only major one being in the first 1 week after the surgery, I generally do not allow my clients to drive a car or ride a bike, mainly because our road conditions are unpredictable. Suddenly someone pops in, you hard brake, the seat belt goes against the chest and causes trauma to the chest. There may be a blood clot development. Of course, this all does not or may not hamper the result, but it causes a mental trauma, saying that, oh my God, what happened? And now what will happen? So don't worry. I'm there to take care of all that situation in case it arises, but best is to avoid it in the first place. So avoid bike riding or car driving for a week at least, or maybe 5 days are also enough. Then you come back on the 5th day, we remove the dressing, we see if there's any collection, any seroma or anything of that sort, which usually is not the case. Grade 3, the higher ones, and grade 4, sometimes they may get by around day 7 or so, when the liquefaction of the fat occurs and the body starts secreting fluid over there because of movement of the pec major, what has come into the picture by that time, by 5 to 7 days. Another question that I get frequently asked, is the surgery painful? Trust me, the gynecomastia surgery is not a very painful affair, whether we do it with power-assisted Vaser, or we do it, liposaver, or whether we do it with, the Embrace RF, the body tight. So none of these modalities cause a lot of pain, which is unbearable or something. If you ask me, on a pain scale of 1 to 10, 1 is no pain, 10 is maximum pain, I would put it somewhere at 3 or 4 max. And if you take painkillers, it even comes down. So you can resume your desk jobs and all after, say, like about 3 days, 2 or 3 days, and a little bit more heavier jobs after about 1 week. So just give your body a little bit of rest. Don't worry, this is an investment, because you've done a surgery with a permanent result. So this 1 week of your life is very crucial for your body to heal. Let it heal. That's what's necessary. And apart from that, then the garment is necessary. Also, you can have a bath below the garment even in those first 5 days. Nobody's going to stop you. That's absolutely fine. Once when the garment is off, you can definitely have a luxurious bath. You can dive into the swimming pool. There's absolutely no problem. Third question most commonly asked is, when can I fly back? Suppose I've come from outside the country, when can I fly back? Usually, if it's a higher grade, wait for about a week or two, at least 10 days, 10 to 14 days. If it's a lower grade, definitely 1 week should be enough, because cabin pressure changes while traveling, and traveling itself is a stress. So add to that the aviation, nuances of cabin pressure changes and all, and that may lead to seroma collection. Why do we want that when we can honorably avoid it in the first place? So give me 2 weeks in case if you're a high graded gynecomastia, and give me about 1 week maximum for a low grade gynecomastia. 10 to 14 days on an average is enough. Then you can definitely fly. Just be careful and be vigilant whether there's any collection coming in or not. Smaller seroma, say like 10, 20, 30, 40 cc, they disappear by themselves also. Even if you wear the pressure garment, it's not going to stay there lifelong. But if it's a larger one, say like 100 cc or 150 cc, then definitely you need to tap it out. It is not going to settle off on its own so soon. Now, how will you know whether it is of a 10 to 20 cc or 100 cc? You will definitely know, because I would have shown you the photo of the gland. If now you feel, after feeling this, that it's as good as the glandular size again, then definitely there's a large swelling, okay, large seroma. And if it is smaller than that, if it's like suppose you had a gynecomastia the size of a tennis ball, and this fluid collection is the size of a marble, just leave it there. It's not going to be of much consequence anyway, but just keep a track that it is not increasing in size. If it is, then definitely you need to come and meet me over here, so that I can deal with it appropriately. And after 3 weeks of the surgery, you can definitely begin with cardio exercises. After 6 weeks, you can definitely begin with heavy duty weightlifting and all. So these are the only restrictions that come in gynecomastia. Apart from that, there are no food restrictions or anything of that sort, that you can't eat this, you can't eat that. You can do everything what you wish. No worries with that. And well, that's all about gynecomastia in a nutshell. I wanted to keep this video really short and concise. It's as good as my consultation, what I do in my chamber, with a little bit of changes. Like for smokers, there may be certain criteria for certain, types of chest. Sometimes there is an asymmetry, only one sided is there. Sometimes it may be on both sides. So gynecomastia can be unilateral or bilateral. What that means is one side of the chest may be larger than the other. That can also happen. It's just like the female breast, because no two breasts are the same. So why should any male chest be the same on both sides? So don't bother about the result immediately after the surgery. Doctor, there is some asymmetry here, there's some swelling here, but there's no swelling here. I've generally noticed that the right side settles faster, because most of the individuals are right-handed. They work with the right hand, but the left one takes some more time to settle, because the swelling takes some time to come down, because that arm is not used. So after about a week, I generally ask them to start massaging the chest gently with a moisturizer or coconut oil or anything that lubricates your hand and decreases the friction. So you're supposed to start massaging gently your chest and the sides, and start moving your pectoralis major muscle, so that your movements start, and any fluid collection also comes down. So that all is going to add to your to the benefit. You can also do a little massaging with diathermy, or not diathermy, sorry, massaging with an ultrasonic device. Even that is fine, what the physiotherapists generally have. But generally you don't need to do that much. It all settles down well. So gynecomastia surgery basically ranges from, say, roughly about 60-70,000 to about 1 lakh to 1.2 lakhs. Also, it can go up to, the range is wide, because the grades are wide. You have grade 1, you have 2A, 2B, 3, and 4. So roughly you can say 70, 80, 90,000, and then 1 lakh. So the thing is, the range varies depending upon your condition, how much fat you have, how much tissue you have. Be rest assured, the result is there, guaranteed. There's no doubt about it. This is a permanent surgery. Almost the gland never comes back. And it's like an investment, frankly. That's what I tell my clients. It's an investment. You invest in your body at an early age, and you reap the benefits for the rest of your life. It's not like you're coming out 50 and getting the surgery done, like say like a facelift. But this is a surgery. If it is done something like 18, 19 or something, also it's fine, because it's gonna be a result that's gonna stay with you for the rest of your life. So definitely, why not invest in it? Why not invest in your body? So okay, that's about it. I guess I've answered most of the common questions that keep coming in gynecomastia. And yeah, this can be combined with other surgeries also, because gynecomastia basically takes 1.5 to 2 hours, not really more than that. So we can do something like a blepharoplasty, an eyelid surgery. But generally, the younger guys don't need an eyelid surgery unless you've got the baggy eyes kind of thing. And we can combine other area liposuctions also with it. Like somebody wants the love handle lipo, the tummy lipo, back lipo, arm lipo, something of that sort can be done along with this surgery. So it's a safe surgery, guys, don't worry. And we have a good success ratio in this. that the results are definitely evident and people are happy with the way the results turn out. So don't be afraid. If you have any doubts, feel free to write in the comment section, or talk to us directly online, and we'll be more than happy to solve any of your queries pertaining to gynecomastia. So that's it for now. Thank you so much for your patient listening, and be in touch. That's all. Thank you so much. Bye bye.